L is for Lorazepam. And Lorazepam can be used for lots of things, anxiety, for CT scan or various things, but the most common thing we're using it for emergently in the emergency department is for status epilepticus. And the appropriate dose for Lorazepam in this indication in adults is 4 milligrams IV. In pediatrics, it is 0.1 milligrams per kilogram up to a maximum dose of 4 milligrams. And when we give it IV, if you're familiar with it, it usually is refrigerated, and it comes out of the refrigerator it either comes out of the refrigerator or it comes out of a room temperature space with an expiration date on it, which is fine, but it's very thick. It's almost like a gel. And so before you give it IV, you should dilute it at least 1-to-1 with normal saline. So it should not be drawn up straight and given IV because it's so thick. It's just really hard to get to its site of action. And so it should be diluted at least 1-to-1. I like to use a sodium flush. Obviously, that's what we have readily available, and some sort of pre-mixed, easy to inject formulation. So pulling it up into a sodium flush is absolutely fine, but again, at least 1-to-1 to make sure that it's easy to give. Also, we don't usually give Lorazepam IM for that same reason. It's just a really thick gel, and so giving it IM is, once they do come around, super painful, and also its absorption is really varied. So if we're going to give a benzo IM, Versed should be our benzo of choice, and the dose there is 10 milligrams IM. So giving like 5 milligrams IM is too low of a dose. And so if they come in from EMS or whatever the case and they've gotten 5 milligrams IM of Versed, it makes sense to either give them a supplemental dose of Lorazepam IV or to redose them with an additional dose of 5 milligrams IM of midazolam. So that's that. L is for Lorazepam, and everybody relax. I'm getting my eyebrows taken care of today, so we can all just stop worrying about it. Farm ER, thanks.